Medicare isn't hard because it's complicated. It's hard because deadlines sneak up on you. You're being inundated with mailers, phone calls, advertisements, and tons of options telling you that, hey, we're the next best thing since sliced bread, but only if you call today. Sound familiar, right? I call this the Medicare monkey. It hops on your back about 6 to 8 months before turning 65, and it nags at you every day until you finally make a decision. This video is designed to help you reduce your anxiety and explain to you your real options related to your Medicare and to help you avoid common mistakes that people make, specifically in 2026. So whether you're turning 65 or about to retire or already on Medicare and just wanting to review your plan, this video will give you the clarity and the direction you need to make confident decisions regarding your healthcare. Hello, my name is Edwin John Rodriguez, your licensed insurance representative. And on this channel, we discuss all things health insurance with a focus on Medicare and ACA plans. Since 2007, I've had the pleasure of helping thousands of clients shop, compare, and enroll on plans based on their needs and goals. I often say to my clients, I'm the best free help you'll never pay for. If you get value from this video, all I ask in return is to share this video with someone you think may benefit from this helpful introduction to Medicare. Okay, now let's get into it. Now, first, we want to talk about some important dates you're going to want to remember. Initially, whenever you first become eligible for Medicare, you have your initial enrollment period. We call this the IEP. This is going to be the 3 months before your birth month, the month of your birth month, and 3 months after your birth month being the month you turn 65. This is the time where you're able to pick a plan based on your needs and goals. You can shop based on which plan makes sense based on your doctor's medications. You can choose to go with an Advantage plan, a Medicare Supplement policy, or a Medicare Supplement with a standalone drug plan. And those are your initial options when you first become introduced to Medicare. Now, every year, you also have an opportunity to make changes to your plan that we call the annual enrollment period. This is for anybody who's already on Medicare. And this time of the year, you can actually make changes to your program, whether you're deciding to go from an Advantage plan to a Supplement, an Advantage plan to a standalone drug plan, or to change up your existing Medicare Advantage plan. And again, those dates are from October 15th to December 7th of every year. For individuals who are on a Medicare Advantage plan, there's actually a second enrollment period that we call the open enrollment period. And the open enrollment period is a time where you can make one final change for the year, which occurs between January 1st and March 31st. This is limited to only folks who have Medicare Advantage plans. So you have to make decisions related to your drug plan by December 7th. If all you have is a standalone drug plan, that does have to be taken care of by December 7th. The open enrollment period is designed specifically for people with Medicare Advantage plans. Now, a common question my clients ask if they're able to make changes outside of the traditional enrollment period. And the short answer is yes. But there are certain circumstances that are life-triggering events that will allow you to be able to make changes outside of your enrollment period. Some common special enrollment periods will include a move. So let's say you're moving to another county or another state where your plan is not available. That's going to qualify you for a special enrollment period to be able to make a change outside of the traditional enrollment period. This is generally going to be about a 60-day window where you can actually make a change to another program, whether that's changing your Medicare Advantage plan for a different one in a new area or updating your drug plan. Now, for the supplemental policies, those plans do not require for you to make a change if you're moving to another state in most cases. Simply, all you have to do is call up your customer service and let them know that you've updated your address, and they'll be able to update that information on the back end. Now, keep in mind that may affect your premiums in the new area because all plans are rated based on the zip codes in which the client resides. And whenever you have a special enrollment period for moving, it's going to be a 60-day window. That 60-day window is triggered when you update your address with Social Security. So some folks forget to update their address with Social Security, and eventually the insurance company will find out that you've moved and then send you a nasty letter telling you have to enroll into a different plan before your existing plan terminates because you're now in a new service area. If you update your address proactively with Social Security, the correct way to do it, then that ticker is going to start. You're going to have 60 days from that date to make a selection on another plan. My recommendation for my clients when they tell me they're moving is to reach out to me about a month or two in advance so we can start identifying some of their plan options in the new area prior for their move. I've actually had a couple scenarios where clients said, well, hey, it doesn't really look like it's a good idea for me to move just from the sake of insurance. Now, obviously, we're not changing where we live just for our insurance, but that is something to consider. Your options can change depending on where you move to. Another special enrollment here we have are for folks with specific chronic conditions like diabetes, cardiovascular disease, or COPD. This is a one-time special enrollment period that you're able to make one change in the year to a plan that is going to accommodate those specific needs. Not all companies have special needs plans, and not all special needs plans are designed for everyone. So you're going to want to make sure you're checking your doctor's medications to make sure those plans would be an option for you. We do have other videos regarding special needs plans, so take a look at our library and we'll introduce you to a deeper dive into the ideas of these special needs plans. Another special enrollment period we have is a loss of employer coverage. So this is when you actually fully retire from your employer and you're wanting to now go the Medicare route. At this point, you're going to have another 60-day special enrollment period to be able to make a change to a Medicare plan of your choice in that window. And whenever you do retire, you're going to want to pair up your Part B start dates, so the Part B of your Medicare, to begin on the month in which your plan is going to be canceling. So for example, you're retiring in March. At the end of March, you're going to want to have your Medicare Part B activated as of April 1st effective date. Feel free to reach out to my team and I regarding your needs related to retirement, and we'll help guide you through this process. There's a couple extra steps that are required when you are retiring after turning 65 to avoid some penalties. Now let's talk about some basics about Medicare. Medicare is mainly broken down into two base parts. You have Medicare Part A and Medicare Part B. Medicare Part A is going to be anything for inpatient care. So if you're admitted in a hospital, skilled nursing facility, hospice care, that's where your Medicare Part A is going to cover you. Your Medicare Part A generally is at no cost. As long as you work 10 years in the United States, you're not going to have a premium for your Medicare Part A. It's totally free, but you will have some out-of-pockets related to your straight Medicare A. Again, we're talking about just assuming you have only Medicare. Now, in the event that you are hospitalized with straight Medicare, you're going to have a deductible of $1,736 just to go to the hospital. Whether you're there 1 day, 2 days, 60 days, it's a $1,736 deductible. Now, again, that covers you for anything in an inpatient setting. You have a second part to your Medicare, which is Medicare Part B, as in Bravo. This is going to cover you for anything outpatient, anything outside of the hospital. So think doctor's visits, outpatient surgeries, labs, imaging, therapy visits, anything that's essentially outside of the hospital is going to be considered the Part B portion, which falls under the medical portion of your coverage. Now, with the Part B of your Medicare, there isn't a monthly premium. Assuming your income is in the standard level, you're not a high income earner. In 2026, your Medicare Part B premium is going to be $202.90 per month. That's the standard cost of your Medicare, assuming you're not a high income earner. Now, if you have your Medicare Part B as well, Medicare is going to cover 80% of your health care, leaving you with your differences of 20% plus a deductible. There is a one-time Part B deductible, and that Part B deductible for 2026 is $283. Now, depending on the plan you have, some of these out-of-pockets may or may not apply to you. But again, what we're talking about is just standard Medicare only, assuming you have no other coverage. You never spoke to a licensed, charming, and good-looking representative like myself, wink, wink, and you didn't get changed up to another plan. So we're talking about straight Medicare here. Now, the Part A and the Part B portions of your Medicare is the foundation of your coverage. Think of this as like the foundation of your house. Before you and I can build off of that foundation, we have to make sure that foundation is poured. That's the Medicare A and the B. From here, you have decisions to make. There's a third part to your Medicare here, which again is not the foundation, but it is something that is required, and that's Part D, as in drugs. The Part D portion of your coverage can come one of two ways. You can either buy it as a standalone drug plan that you pair with your Medicare or supplement policy, or you can have it combined into a Medicare Advantage plan. That's where they combine the medical and the drug coverage all into one plan. More on that in just a moment. But with the Part D portion of your drug plans, the premiums can range depending on which plan you decide to go with. We've seen plans as little as zero premium. We've seen plans as high as almost $200 per month. With the Part D portion of your drug plans, you do have out-of-pockets that you have to meet. Depending on the plan that you go with, you may or may not have exposure to some of these deductibles. But just to talk about standard cost related to prescription drug plans, you have a deductible of $615. Now, that is a standard part deductible that you need to pay before your insurance policy is going to help you with certain medications. Now, again, this is plan specific. Some plans, if you pay higher in premium, or some Advantage plans will actually remove that deductible and you'll have coverage day one for your medications. Something new for 2026 as well is a new cap. It's actually started in 2025, but they've carried it over to 2026 as well. And this cap, you got to think of this kind of as like a safety net. So this cap is $2,100 for 2026. This cap is designed to protect the consumer, to make sure you're not being nickeled and dimed for medication costs throughout the year to where you end up having to file bankruptcy or clearing out your bank account just to afford medications. This $2,100 cap essentially is a promise saying you're going to be responsible for some out-of-pocket related to your prescriptions, but you're guaranteed never to spend more than $2,100 in the calendar year. Now, this is a big improvement as of the last couple of years. This was actually carried over from expansions of different laws built into the Inflation Reduction Act. It was also expanded a little further, part of the Big Beautiful Bill. We have another video related to the Big Beautiful Bill you can watch right here if interested in getting a deeper dive into those details. So keep in mind as well, whenever you're shopping your Part D drug plans, you're going to want to make sure that your medications are covered. Every drug plan is going to have a formulary, which is a list of how the medications are covered. You want to make sure that not only are your medications covered, but they're covered well. Reach out to a licensed insurance broker in your area, or feel free to reach out to my team and I. We're happy to help you out with shopping plans based on medications as well. Now, the fourth part of your Medicare is Part C. Part C is what we call Medicare Advantage plans. And this is where private insurance companies take your Medicare and your Medicare Part D and they combine it all into one policy. This is what we call Medicare Part C, also known as Medicare Advantage plans that include prescription drugs in most cases. We'll have more information later in this video about what Medicare Advantage plans are. So whenever it comes time to make a decision related to your Medicare, you have really two main options. Your first option is what we call Medicare Supplement plans. Now, if my clients go the Medicare Supplement route, and it's a big if, it all depends on clients' needs, but if a client goes the Medicare Supplement route, the most common plan my clients like to go with, if they go the supplement route, is Medicare Supplement Plan G. Why is that, Edwin? Why is Plan G the common route if someone's going the supplemental route? Well, the main reason why is because Plan G has two main bullet points or two main features. The first main feature is no network. And what that means is as long as your doctor accepts Medicare, they're going to accept your supplemental policy, meaning you're not having to worry about provider networks. You're not having to worry about directories or calling up offices to see if they take your insurance. You just very simply ask your doctor, hey, doc, do you take Medicare? If they say yes, you're good to go. That means they're going to also accept your supplemental policy. Okay. The second bullet point to Medicare supplement policies is that there's no out-of-pocket. Medicare is going to cover 80% of your health care, and your supplement is designed to pick up your 20% plus your deductibles. Now, specifically with Plan G, is going to cover all of your out-of-pocket expenses except for a one-time Part B deductible for 2026. Your Part B deductible is $283. So to think about this in real life, if you have a Medicare supplement plan, you go to the doctor in April, the doctor says, hey, you have to go to the hospital. They have to do surgeries. They have to run tests, whatever it may be. Edwin, what do I pay? Medicare is covering 80% of your bill. Your supplement plan is picking up the rest of your differences. Again, you do have that one-time deductible of $283. Think of that also as your maximum out of pocket. But once that's met, your hands are washed, you're done for the year. Edwin, what if I'm spending 10 days in the hospital next week? Zero. What if I have to have cancer treatments? Zero. What if I have to XYZ? Doesn't matter. Between Medicare supplement, they're going to cover all of your out-of-pockets together. Okay. Again, I'm not here to tell you what the right option is or what the wrong option is. There's really no way to know until we dive into your file specifically. It's all based on your individual needs and goals. Feel free to reach out to my team and I for a detailed conversation regarding your individual needs. The prices of supplement plans can depend on many factors, depending on the plan specifically you're looking at. But again, just to keep things simple, let's assume we're still talking about Plan G. With the supplemental Plan G, the plan's premium can range anywhere between $100 to $2-3 per month, depending again on where the client resides. Tobacco status, gender matters as well when it comes to supplement policies. So again, make sure you do your due diligence. When it comes time to shop supplement policies, what we're shopping normally is going to be for your price, not brand preference, because supplement plans are going to cover you the same across the board, whether you go with a Plan G with United Healthcare or Mutual of Omaha or Blue Cross Blue Shield, doesn't matter. Supplement Plan G covers you the same across the board with every carrier, generally speaking. If you do go the Medicare supplement route, you do have to add drug coverage onto that policy. It doesn't include it, so you do want to purchase a Part D drug plan. That's something we take care of during our consultation. So if you decide to go the supplement route, then all we're doing is really just shopping the Part D drug plans based on your medication needs. That's the Medicare supplement options in a nutshell. We have a second option when it comes to Medicare, and we call these Medicare Advantage plans, or option 2. I call them as option 2. We call Medicare Advantage plans. The way these plans work is rather than Medicare being responsible for 80% of your health care, or you having to buy an expensive supplemental plan to fill in those gaps, Medicare says this, hey, private insurance companies, how about we pay you guys a set amount every month to take care of Mr. Hart, for example. Whether he's sick, healthy, happy, sad, traveling, staying put, doesn't matter. Medicare is paying the insurance company a set amount to take care of this client. Whether that client needs the coverage or not, Medicare is funding that private insurance company for that client. In turn, in states like here in Florida, we're able to offer clients plans as little as zero premium. Zero premium, Edwin, what's the catch? How can I get insurance at no cost? Medicare's funding these policies in the background, whether you're using the coverage or not. So they're getting paid in the background hundreds to thousands of dollars per month, depending on the client, the plan, the zip code, the client's individual needs. the insurance company is getting funded in the background to take care of that client. So with Medicare Advantage plans, they're offered to you as a little zero premium. Again, the way they're funded is Medicare is paying a set amount every month to the insurance company to take care of you. Now, the catch to these plans being a zero premium is that you do have to use doctors and networks. So you want to make sure the doctors that are important to you take your plan. You also want to make sure that you're okay with your potentials for out-of-pockets, because with Advantage plans, they also have copays or cost share related to the program. With Medicare Advantage plans, they can also offer some additional benefits that traditional Medicare doesn't cover, like discounts on dental, vision, hearing, gym membership, and of course, prescription drug policies built right into the program. So you don't have to go shop multiple different companies and plans for shopping medical and then drug plans separately. With Advantage, it's all tied into one package. Because these plans do have out-of-pocket as you're seeking services, there's a feature called a maximum out-of-pocket. And think of that number as a safety net. I always tell my clients, I hope you never need your insurance, right? But God forbid you have a catastrophic year. You want to know that you do have a safety net. You're guaranteed never to spend more than X amount of dollars in the year. God forbid you have a catastrophic year. And that maximum out of pocket, it's not a goal, it's a safety net. Whenever my clients ask me what the best option is for them or what I would do for my family, it's a very difficult question to answer, because for me personally, I work with multiple options. My team and I are contracted and licensed with multiple options and carriers throughout the nation. And our goal is more so fitting the plan to the client's needs. It's never a one size fits all where, hey, this is the plan that works for everybody and this is the one you should do too. But I do give examples for some of my clients. For example, with my parents, we're here in sunny Florida, right in Central Florida. And Advantage plans are very popular here in our state. That's not always the case in every state, but Advantage plans are very popular here in Florida. So based on my parents' needs, they have minimal needs for the most part. They just have a handful of doctors, a handful of medications. We're able to find a happy home for them with Humana. There's a plan specifically here in Central Florida that is Humana Medicare Advantage plan. It's a zero premium plan. That plan actually has a reimbursement feature. More on details related to Medicare Advantage plans in another video. Please check those out for more information about Medicare Advantage plans. But with Advantage plans, the way those work, depending on the plan you go with, some plans will actually help pay for a portion of your Medicare premium. When your needs are minimal for most folks, getting some of that money back or helping reduce some of that Medicare Part B premium, it does help out folks with some of their costs. Specifically for my parents, their Medicare plan makes sense for them. Their doctors are covered. Their medications are covered well. The plan financially made sense. So that's the plan that we decided to do for them. So for what I tell my clients is, just because that's the plan that worked for my parents doesn't mean that's the right plan for you or for my next client or for my last client that I spoke to. That's why we pride ourselves on doing an individual needs analysis, making sure whatever it is we consider for you is the best fit based on your needs, your goals. At the end of the day, though, really it comes down to a dollars and cents conversation. Some folks say, well, isn't the supplemental plan the best protection? I mean, yes, it is the caviar. If you think of the supplement plans, it is the caviar. You're paying good premium for it though, right? If you think about it, you have your standard Medicare premium of $200 per month. Let's assume you have a supplemental policy of another $200 per month. And then let's call your drug plan another $50 per month. So going the supplement route, you're looking at about $450 a month, whether you use the coverage or not. If you do the math on that, you multiply that over 12 months, you're looking at north of $5,000 a year. You're obligating yourself to whether you use the coverage or not. Is that the right fit, the wrong fit? That's for you to decide. My job is to shine the flashlight on your options. Versus with a Medicare Advantage plan, they're little to no premium. Going back to my parents, for example, they're with a zero premium plan with Humana. Their plan is actually paying $155 per month of their Medicare premium. Their portion of their Medicare is not the full $200. They're paying the difference of, let's call it around $50. That's their net cost monthly. Again, they don't have to pay anything extra for medical. It's built into that policy, and the drug plan is also built into that policy too. So their net cost monthly is around $50 per month. Expanded over 12 months is $600 for the year. So the question I ask you is, do you want to obligate yourself to $5,000 per year, whether you use the coverage or not, or have a pay-as-you-go plan and your costs are about $600 per year for the coverage? You pay as you go. God forbid you have a catastrophic year, you're guaranteed never to spend more than that cap of the maximum out of pocket. On this plan specifically, around $3,200. If you do the math on that, 5,000 versus 3,200 plus 600, 3,800. Do you want to obligate yourself to $5,000 a year, or pay as you go up to your total maximum between your max out of pocket? God forbid you even have a catastrophic year. And then of course your premium for that plan. In most cases, most folks aren't planning on having a catastrophic year. That's the point of insurance, protect you just in case you did. But you want to think about it from a dollars and cents conversation. You think you have this for 10 years, for example, right? So how many catastrophic years do you have to have over the course of 10 years in order for it to have made sense with your supplemental policy. I challenge you to do the math on that. $5,000 a year times 10 years, assuming the premium doesn't change. We know that's not going to be the case with a supplement, but let's assume the premium doesn't change. You're obligating yourself to about $50,000, whether you use the coverage or not, versus with an Advantage plan, you pay as you go. God forbid you do have a catastrophic year in year 5, then you're hitting that maximum of $3,000 in that year, still ahead financially. There's pros and cons to all of this, but we do have other videos related to Medicare Advantage versus supplemental policies that I do encourage you to take a look at for more details related to the two and comparing side by side. My honest recommendation at the end of the day, when it comes to these plans, it really is going to be coming down to what's best based on your individual needs. So who are your doctors? What are your medications? What is your frequency that you're looking to be using your insurance at? And that's what we use as a guide with helping you shop the plan based on your individual needs. There's no wrong, no right answer. Medicare is not a one-size-fits-all option. We want to do your own due diligence and shopping different options based on your needs and goals. And going back to comparison with my parents, what's good for the goose, my parents, is not always good for the gander, the rest of my clients. And what's good for the gander, all of my clients or majority of my clients, is not always best for your individual needs. For me personally, I'd say it's about an 80-20 split. 20% of my clients go the supplemental route because that's what works based on their needs, goals, and budget, while another 80% of my clients focus more on the Medicare Advantage plan side because that's what works based on their needs, goals, and budget. And that's why experience matters when you're dealing with an insurance representative related to your healthcare needs. It's not just a guess as far as what works for you. We actually fine-tune your policy based on your needs. A lot of times in my consultations with my clients, as clients are sharing information with me, doctors, medications, my wheels are already turning and I'm starting to think of solutions as we're having that conversation. So by the time we actually have everything we need, I already have an idea of a direction that we're going to want to go. Now, as promised, for my honest recommendation, what is the best plan? The best plan is really going to come down to what fits your doctors, your medications, your budget, and of course, your risk tolerance. Medicare is not a one-size-fits-all. What your neighbor's opinion is about their plan, or yours for that matter, is just that. It's just an opinion. Everyone's needs are different, and your shopping journey should reflect those differences. And that's why conversations with an expert in their respective fields matter. So if you need help with your health insurance, consider giving us a call. Collectively, my team and I have well over 2 decades of experience. So now you know how Medicare works in 2020, key deadlines to watch out for, and how to choose between Medicare Advantage plans and Medicare Supplement plans based on your real needs. If you made it to this part of the video, thank you so much for watching. You've obviously received some value out of this, and I'm sure you can think of a few friends or family members that you can help out by sharing this video with them. Not only is it a compliment on the job I've done here and presented this information today, but it's going to have huge value to the person you're sharing this information with. If you're still weighing your options and need some guidance from a trusted expert, feel free to schedule a call with my team and I. We'll be happy to walk you through it. No pressure, no sales pitch, just clarity related to your needs. If you got value from this video, consider watching this video next to learn more about Medicare and your options. And until then, take care and thank you so much for watching. Now,